Hello, I'm Dr. Richard Channick from Mass General Hospital in Boston, Massachusetts. And today I'm going to summarize some of our findings in a specific poster we're presenting here at ATS related to our PERT program. PERT is Pulmonary Embolism Response Team. This is a program we established at Mass General Hospital about 4 years ago to really deal with a very serious problem, acute life-threatening pulmonary embolism. And we established a multidisciplinary team where we could very quickly respond to these patient problems. Using the PERT system, we've really developed a very, really a rapid response team and have dealt with hundreds and hundreds of these very seriously ill patients with a life-threatening condition. PERT, just as an aside, is now nationwide, and the PERT concept has really extended through many hospitals around the country, as well as even internationally. As part of our PERT efforts, we collect a lot of data on what happens to patients who suffer acute pulmonary embolism that are cared for by the PERT team. And what we find is that we think we're making a big difference with some of these interventions. The poster that we presented or showed today was a very specific aspect of PERT, which related to the time of activation of the PERT team and how that affected the intervention. So what we did was we divided all of the PERT calls we had taken into day versus night, and then looked at what interventions these patients ended up getting and what was the outcome. And it turns out that patients who were activated during the day tended to actually get more interventions more quickly than when the activation was at night. Now that maybe it's not surprising in that calls during the middle of the night, we may tend to watch these patients. One could express concern that therefore a patient who has an acute PE at night won't do as well because they won't get as much of an intervention. It turns out that was not the case. And in fact, although the patients who suffered the PE and the team was activated at night had exactly the same outcome as patients who had the pulmonary embolism during the day, despite having fewer interventions and having a greater delay in the time to intervention. We need to look at this data a little more closely, which we'll do in the future, to understand that finding. But at least on the surface, it would appear that one approach could be if the patient gets a pulmonary embolism and the team gets activated and the patient may need an intervention like a catheter-directed intervention, possibly that patient could be observed and it isn't necessary, for instance, to activate an entire cath lab at 1 in the morning to put a catheter in that patient. We're going to be looking into that more prospectively. So I think it's an interesting finding where we're really looking granularly at some of our PERT data, and there'll be more to come on this. Thank you.